Hello, I'm Alex Hamilton from the University of Bristol in the United Kingdom. This is a CJASON podcast that will discuss our systematic review of psychosocial outcomes for young adults on renal replacement therapy. Although physical growth stops in our late teens, our brain development continues into our mid-20s. Young adulthood is a unique period where we see increasing independence, decision-making, self-exploration and experimentation. The majority of young adults on renal replacement therapy have a kidney transplant, but they are more likely than other age groups to experience graft loss. We wanted to establish if young adult kidney patients lead comparable lives to their healthy peers, specifically in terms of social status, psychologic aspects, and lifestyle. We searched 9 databases for studies of 16 to 30-year-olds on renal replacement therapy that reported either socio-demographic or lifestyle outcomes, or validated psychologic health tests, for example, quality of life scores. In order to combine quality of life scale scores, we had to convert multi-domain scores into a single score. We then pooled data in a random effects meta-analysis. The studies we found were mostly single-centre, cross-sectional, and focused on young adults who were transplanted as children. Compared to healthy peers, we found lower quality of life in all young adult patients, which was worse for patients on dialysis. Young adults on renal replacement therapy were also nearly twice as likely to be unemployed, despite the same likelihood of higher education. Fewer patients were married or had a partner, and they were also nearly twice as likely to be living in the family home. We found weak evidence of healthy lifestyle, with patients more likely to abstain from alcohol and less likely to smoke, but these estimates were based on limited evidence. We observed high between-study heterogeneity for many of the outcomes. In summary, our systematic review showed evidence of the negative psychosocial impact of kidney failure in young adult patients, in particular, impaired quality of life and limited employment, independence and relationships. I would like to acknowledge that this work was supported by a grant from Kidney Care UK and Kidney Research UK. Thank you for listening to this CJASON podcast.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.